outbreak. And essentially what we're going to be diving into today is we know that we need to be prepared, but how do we do that? And what effects does a pandemic outbreak have, not just personally, but also for your credit union and your business continuity. So today's webinar is going to be led by Tim Doherty, who's our Managing Director of Business Continuity Planning at Ongoing Operations. And the format will be about a 20-minute presentation followed by 10 minutes for open Q&A from participants. So if you have any questions as we're going through, or also if you want to just save them to the end, of course, please feel free to do that. But go ahead and type those questions into the questions chat box, and I'll go ahead and relay those over to Tim, and we can answer any questions you all have on pandemics. So please go ahead and grab your latte or your cup of coffee, and I hope you enjoy this installment of our series. And I'll kick it over to Tim to start us off.
Great, thank you, Amy. Good morning, everyone. So as we are all aware, the current outbreak of the coronavirus, or the COVID-19, is spreading around the globe pretty rapidly. This morning, I'll be sharing some information about what this means to you personally and for your business. So our agenda, we're going to take a look at reviewing the pandemic timeline and the status of the COVID-19, and also talk about business and personal impacts, and also the mitigation strategies that we may already have in place or we can actually put in place. So looking at the timeline, we can see that the outbreaks and pandemics are nothing new. We've been dealing with these through the past decades, and what is new is how business and people prepare, plan, and respond to each of the new incidents. Your best resources for information are the World Health Organization, and their website, if you aren't sure of it, is who.int. And the Center for Disease Control and Prevention, their website is the cdc.gov. They have a comprehensive website that has most of the up-to-date information, including an easy fact sheet on what you need to know, guidance on prevention, control, and also guidance for travelers. So with the coronavirus, or the COVID-19, the symptoms seem to be moving slowly, but yet the actual virus is moving rapidly and spreading across the globe. So I wanted to share some statistics with you here. These statistics are as of yesterday, and of course they have changed overnight, but just to give you some information here, an idea. So this information is from the World Health Organization. Currently, there are over 93,000 cases reported globally. And globally, there are 3,202 deaths. And the recovered cases, or the people that had it and have been recovered or had recovery, is over 50,000. So approximately a 3% mortality rate. But a lot of the information that's not being shared out to the public, or rarely shared, is the recovery rate is about 55% right now with this information that we're looking at. So now, for comparison, I wanted to share some stats about the flu virus. Okay, this is statistics from Johns Hopkins, and they estimate about 1 billion cases of the flu worldwide. And now there is a huge range as far as the statistics for their deaths that they are looking at worldwide. It ranges from 291,000 to 646,000 deaths worldwide. So that's between a 29 to 64% mortality rate compared to a 3% mortality rate with the coronavirus. Now, I'm not trying to downplay this, but I just want to make sure that people understand that the coronavirus isn't the only thing that we should be planning for. Our pandemic plans should not only occur when there's a large outbreak like this, but it should be continuing throughout each and every year, because as you heard from the statistics that I gave, You know, the influenza has a large impact or a larger impact on the globe or even the US. For example, in the town that I live in last year, with the influenza outbreak, they needed only 2 more students to actually come down with the flu, and they would have actually shut down the whole school or the independent school district. So, you know, we need to keep planning and making sure that it's not just when there's a huge outbreak. Pandemic planning should be occurring annually. You should be looking at your plans, et cetera. So now we want to take a look at the business and personal impact areas here. Let's start talking about some of the impacts that we have to our businesses and personal lives. So starting out with our global impacts. Looking at the financial markets, I'm sure everybody's been watching the news, looking at your investments and other things. They've been going up and down a lot lately due to the news that's coming out about the coronavirus. And I'll be talking more about, you know, how it actually hits and affects us personally a little bit later. With our travel, most U.S. companies have imposed international travel restrictions. Now, domestic travel is not necessarily restricted at this time. And then when it comes to taking a look at our supply chains, I'm not sure how many people are, when they're doing their disaster recovery and their business continuity planning and their pandemic planning, start taking a look at what if there is a supply chain disruption? What are our supply chains? What do we need to take a look at as far as different tech companies? If we're getting supplies and computers, et cetera, in from these different companies, how is that going to affect us? And then kind of on a personal note, drug manufacturers. Where are the drugs being manufactured and, you know, being shipped into the country, and how is that country being affected currently? And a good example is the N95 masks. Most of these masks are made or manufactured in China. So as we all know, with the outbreak of the flu that we have, the coronavirus, excuse me, and you know, it shut down the manufacturing. And for those of you that have masks, that's great. And for those of you that are trying to get masks, you can understand that there is a back order right now on those. And so it's a little bit harder to start getting supplies that we need for our pandemic planning. Now, also, as we start taking a look at the multinational retailers, you know, it can only, with the supply chains, it only takes one missing part to stop an entire assembly line. So an example, you can just ask Apple on that. Ask them about their phones, and the car manufacturers also. Now, going down into our local impacts, this list is not necessarily to be considered the be-all, end-all list. This is just some impacts that I'm sharing to try to help get people out what could impact you, your area, your community, and your business, and also your personal lives. So from the government, when we start taking a look at what's actually happening, we need to start considering what will happen in our area, in our local area. Currently, you know, at the upper echelon, we've got the CDC, the World Health Organization, a lot of medical people and doctors and everybody in the hospitals, et cetera. They're really working long hours trying to make sure that this virus is contained and they can try to get some sort of treatment or vaccine prepared. So there's a lot of, I want to say, mental stress going on, but there's a lot of work that they're putting in, long hours. And one of the things that I did want to bring up and let everybody know that just because the CDC is putting out recommendations, the World Health Organization is putting out recommendations, your local public health plans and what they actually recommend and what they put out as restrictions in your area are going to trump whatever the CDC or the WHO puts out. So once again, your local public health whatever their decisions are that may affect your local community, they actually supersede or override what the CDC and the WHO are recommending in your area. So now some other areas that we can take a look at, and I'm sure a lot of people have this in their plans, but places where people gather, or schools, restaurants, churches, how is this going to start affecting our planning when we're taking a look at our staffing? So if the schools start to close, shut down, then what happens to your staff? Who is going to be able to take care of those children? Are your staff going to have to stay home? Can they work from home? So there's just some considerations that need to be put in place. And then also one of the impacts just for the local economy, once the businesses start shutting down, they start having some financial impacts to the local economy. The hospitals are adjusting different triage procedures on how they're handling the sick patients or people that are coming into the hospitals that are showing symptoms. They're, of course, asking if people have traveled to any of the infected locations, et cetera. So there are definitely the people that are working at the hospitals, they put in long hours, but now this is an added stress in their lives also to actually make sure that they're not going to actually get the disease or transmit it to their families. With the grocery stores, I wanted to bring this up. It's a big supply and demand thing that's going on right now. I know some areas of the country are actually, people are starting to stock up on non-perishable food items, depending where they're at. And I recommend basically, if you feel the need that you need to start going out and stocking up on some of the non-perishable food items, feel free to go out and do so. And I would just do it in moderation if your area has not actually experienced any of the cases at this time. So different companies are canceling events, and they are starting to cancel some of the non-essential travels, domestic and business travel. The World Health Organization, though, is not recommending to cancel travel at this time. So you get a little bit of different recommendations on where you decide to take a look at the information you're getting from. But I read this morning that the Credit Union Times were reporting that the union industry is considering conference adjustments, cancellations in light of the coronavirus. So they're looking at their list that they were actually had in their document. It was basically only one of the actual organizations that they had listed was actually making any adjustments to their actually board meeting. So it was the World Council of Credit Unions. They moved their April board meeting from South Korea to Chicago. So that's really the only one that I've seen and that I've heard of right now as far as different conferences or meetings in the credit union industry that's happening. But definitely, if you have plans for attending a conference, I would check in to make sure that it's not been canceled or relocated. You should be receiving some information from that organization should they cancel or relocate, but it doesn't hurt to reach out and be a little proactive with that. And then one of the other things, if you're in an area where your staff actually gets to work using mass transit, then we need to start thinking about what happens should the mass transit shut down, the subway or metro or the bus lines. What does that impact to your staffing resources that you have at your business or at your credit union? So these are just some of the local impacts, like I mentioned, that need to be brought up. We need to have a discussion about in our meetings that we're having about our coronavirus and our pandemic planning. So before I move on to the next one about credit union impacts, we have a poll that we'd like to put out for everyone. Amy?
That should be popped up on your screen. So the question is, do you think more people will want to use cash or plastic cards? And Tim, we've got about, I don't know, around 70% or so who voted. So we're seeing around 75% of people thinking plastic cards and around 25% thinking cash.
Okay, perfect. So it's going to really depend on your area, I believe, and what there's going to actually be and consideration that has to be taken in your meetings that you're having discussions about pandemic planning currently. You know, will there be an increased demand for cash? And with that high demand, will that equal more money that we need to actually place in, you know, for our cash orders that we have to increase money in your ATMs? And also we need to start taking a look at the increased call center usage. People are actually going to start calling in more, trying to do things more remotely and have less person-to-person interactions. And then when it comes back once again to the supply chains, how are you getting your cash? Where are you able to possibly try to order cash and stock up a little bit more currently? Do we want to just go ahead and up limits, lower limits on, you know, the ATMs, et cetera, depending on how much supply of cash we currently hold and what we have? And then also we need to take a look at, from the supply chains, your shipping and delivery. So when you're receiving shipments in for different things that you have ordered, or from FedEx, and another large, we'll call shipping delivery service, is the U.S. Postal Service. Currently, you're getting payments through the mail. Cards are being sent to members through the mail, statements, other documents, et cetera. So we need to make sure that, you know, we have some other way, should the, you know, U.S. Postal Service say we're not going to be delivering into your area. Is somebody able to go pick this up? Who's able to go pick up the mail? And how are we going to get those payments so we can actually get them processed? And there also may be a slowdown in lending, taking a look at your auto loans and your real estate lending, your mortgages. So just be aware that once this starts getting into an area, a lot of people are going to start shuttering themselves in and probably not want to go out and look for that new car. Let's put that on hold and see what happens with the coronavirus, or let's put our purchase of this house on hold. So there may be some consideration that you need to take and have some discussions about, you know, your lending or your loans start decreasing a little bit. Then take a look at your critical vendors. And what we're looking at here is really their staff shortages. What is their plan? Do they have a plan in place should something happen in their area where their staff is affected, they can't come to work? You know, so we need to reach out and find out what our vendors' plans are and how they're going to still continue to support you and provide the service that you have them contracted for. And then a big one I'm not sure if everybody's really considered is budgetary needs. So we may have to take a look at reallocating some funds for possible remote access for people that need to do those critical and vital processing from home or at a remote location if they don't currently have it. Laptops, so they're able to work from home or an alternate location. Different supplies for pandemic, as far as when we're sitting here ordering the hand sanitizer solution, masks, et cetera. I don't know how many people actually budget for that sort of thing. And then also any other needs that may come up from just sitting there talking and having discussions through your meetings, where you may have to start adjusting and moving some budgeted items around. Okay, so Amy, before we go on to our next slide here about personal impacts, if we could take our next poll, please.
So you see another poll on the screen as we're moving into personal, as Tim suggested. So the question is, have you altered or canceled any spring break vacations or plans? So Tim, we're seeing about 60–70% of folks have voted, and we're seeing an overwhelming about 90% no, and maybe around 10% yes.
Okay. Well, that's good to hear. I'm glad everybody's going to be able to get their vacations and have fun and get some of that mental health breaks that everyone needs. So looking at the presentation here, mental health is really key, because right now there's a lot of stress caused by fear and anxiety of the unknown. People are watching the news and kind of developing their own information sometimes. And some people may actually have PTO canceled, depending on staffing shortages, possibly, or as we start taking a look at areas and travel restrictions into certain areas that people may have vacations planned. So we need to make sure that we are aware of our staff's health, their mental and physical health, as we start going through this and keep going through the wave here that we have of the coronavirus. So some childcare issues that we start taking a look at, where daycares may start closing, or parents may start pulling their children out of the daycares because they're concerned about their child actually being infected. And then also with our emergency preparedness, we want to start taking a look at, what are we doing? And it goes back to, once again, creating that emergency stash of food at home that you may have. And also we need to consider not just the food, but also medications and other things that we need just in daily life. And then with the elderly care, I bring this up only as a point to make sure that people, instead of just dealing and taking care of your children, you also may have some elderly parents that are in a nursing home, and as we've seen on the news, they may want to, and they feel that they need to actually take those parents or their parents out of the nursing home and care for them at home, because they just feel safer. That way, the parents may not possibly contract the virus due to the decreased immunity that elderly people have. So that could impact your staffing once again. So a lot of this pandemic planning, we're really taking a look at your people, your staffing, and how they can be affected. So now taking a look at financial loss, this is what I had mentioned previously. This is where, with the market volatility that we've seen, impacts our 401ks, our IRAs, and other investments that we have. So this can actually cause some undue stress because they're looking at their retirement, maybe their retirement's coming up soon, and they're just worried about how they're going to try to make up this money that is actually being lost right now, we'll say, for any better terms. But it is a concern, and it needs to be discussed with your staff. Should they have any questions about it, please feel free to talk to them and kind of work with them, letting them know that this is just kind of part and parcel of an actual pandemic, and or an outbreak. Things will bounce back. Also, something that's not listed on the screen here, I did want to bring up, is about scams. We have to be very careful about phishing attempts that are going on out there, people selling products marketed to prevent the coronavirus, soliciting donations and other ways just to try to get people's money. So we have to make sure that people are aware, our members are aware, our staff are aware that we have to be very careful and diligent about what's happening, what kind of emails they're answering, what they're clicking on in those emails, what attachments they're opening, et cetera. So we want to make sure that people are aware, and one of the things that we don't want to lose sight on as we're dealing with this pandemic is our IT security posture where we're at right now. So Amy, could you go ahead and our last polling question?
Sure, so that should be up on your screen now. And the question is, how recently has your credit union exercised your pandemic plan? So as we see these trickle in, Tim, it's looking around between 40 and 50% for never, around 30% for within the last year, and around 15% or so within the last 30 days.
Okay, great, thank you. Yeah, so if you haven't actually tested your pandemic plans, I would highly recommend that to everyone to go ahead and break them out and at least dust them off and start talking about them and walk through some sort of actual plan itself, exercise. So I've talked a lot about the possible impacts here that the coronavirus could have on our business and personal lives. These impacts we can't control. So let's talk about some of the things we can control, some of the mitigation strategies that we can put in place. So a lot of people have actually, and credit unions have actually been reviewing their plans. We've been getting a lot of calls from our credit union partners that we do business continuity planning with, and a lot of questions about what needs to be in our plan. Is there certain things that we need to be looking for, and just kind of giving them the guidance and answering questions that they may have. With the plan exercises, I'm a little surprised at the polling numbers, but like I had mentioned, you really need to make sure that we get our plans out, we exercise them by just walking through a simple scenario with, you can take the coronavirus right now, what is happening in the news, and should it get into your community, how are you going to respond? And we also want to make sure that we're talking to our local public health organizations and discussing how your plans integrate with what their plans are. So if there are certain trigger points in your plan where you're going to actually be closing lobbies to branches and only running drive-through if you have that option, we want to make sure that those trigger points, if you're going to start closing branches, we want to make sure that that is in alignment with what your local public health organization's plans are. We also want to start taking a look at evaluating ATM and your remote deposit capture limits. Do we want to increase them? Do we want to decrease them? It's going to really be dependent on what's actually happening in your area. But this should be a line item that's in everybody's plans. So at least we're taking a look at considering, do we actually decrease or increase the different limits that are out there? And also expanding the staffing hours for your drive-throughs, should you decide to close the lobbies and start using drive-throughs only. That way it will help with the social distancing that they recommend when things start getting a little bit more, more cases are starting to happen in your area. And then for alternate staffing, I like to take a look at is asking our vendors also, not just about what are their plans should something happen in their area or affect their business, but what can they do to stand in and help act as your staff, what kind of processing they can actually do. And it might be a good time to take a look at some of those contracts and see what they will do for DR purposes, et cetera. Once again, the supply chains, start anticipating and adjusting your cash orders depending on what you're going to do. And then, if you're going to actually increase the ATM limits, then you're going to, of course, need to increase your cash orders. Or if you're going to decrease it to make sure that more people can get a little bit of money instead of, a few people getting a lot of money out of the ATMs. And then we also want to talk about the safety deposit access. So we want to ensure staff safety. So should there be a location that you have that has safety deposit box and you're looking at actually closing that location, you want to make sure that members are aware, getting communication out to them to let them know that on a certain day we're going to actually be closing this location, and you need to come in and get things that you may need out of your safety deposit box, or just come in and do an inventory to make sure that there's nothing that you need. And then also taking a look at increasing your personal an increase to personal loans. Taking a look at people that are working, the hourly wage, for example, they can't go to work. Do we have a short-term loan in place that we could help them with, almost like the furlough that the government had? People were able to go to work, it's just the government shut down and they weren't able to get their paychecks for quite some time. So, how did other credit unions that were dealing with the people that are, part of their segs, as far as government workers, how were they helping out? You can reach out to other credit unions, find out how they worked it out, and they were able to help their members. And then also with the travel restrictions, when do we want to trigger that? When do we want to put that in place? Do we want to just have people stop traveling to certain areas that may have the cases identified? And then also we want to consider, well, do we want to have our vendors coming in here to visit us? So there may be some type of virtual meetings that you could do instead of having people come on site. And then one of the largest things that you can do is sharing your plan with your employees, making sure that they know what's happening now, letting them know that you're actually monitoring the situation, and also possibly what their role may be in this whole situation and in the plan. This will help reduce the workplace anxiety and that mental stress that they may be feeling. Now, taking a look at some other mitigation strategies here, making sure that supplies are being ordered, and if you have them, are we staging them down in the different locations that we have? Should people want to decide to wear masks or gloves, or do we have the hand sanitizer out already, which I'm sure a lot of people do? Do we have it out for our members? Do we have it for our staff, just to help with the protection of the spread? And then testing the remote work capabilities. As I had mentioned before about budgeting, some people may have the ability to have remote access. Some others may be looking at that right now, but it really starts to help when you have that ability. And should you actually have a trigger point in your plan for letting people know, okay, this is when we're actually going to start work from home. Then taking a look at making sure that our business processes, how can people do them remotely? And then also we want to make sure that we have more than one person cross-trained and knowing how to do those business processes. We also want to make sure that we have written procedures should somebody else have to jump in and help with that certain business process. And then the basic protective measures here with hygiene. Comes to say everybody is always discussing this or putting this out, but proper hand washing and sneezing, coughing in your elbow, and then the social distancing with members, and then also employees. Not only just vendors doing virtual meetings, but we can also have our internal meetings to start meeting. Instead of meeting everybody in a conference room, we can start doing some virtual meetings. Okay. So epidemics and pandemics, they move in waves, so don't get complacent. Now's not the time to panic, but plan. So I hope this was informative and helps you with your planning. With that being said, Amy.
Yeah, so we have, please feel free if anyone has any questions, if anything that Tim touched on or anything he didn't that you would like to ask about, please go ahead and type those into the question section and we'll relay those over to Tim. A few came in during the presentation, Tim, so we can start with, we had a question of also at the end of the presentation, can you quickly go over the current coronavirus statistics that you cited in the beginning?
Sure. So this was as of last night when I actually pulled this information. So the cases globally from the World Health Organization, they were, from when I pulled it, was 93,154 cases globally with 3,202 deaths. And then the recovered cases were 50,944.
All right, and now Tim, we had another question come in of if offices are closed, do you recommend paying staff or should employees plan to use PTO banks?
This will be basically a decision that the credit union will have to make. I know when I go through with different credit unions that we do our tabletops with, some will actually have people use their PTO, others will say, well, we are actually having them stand by and be prepared to come to work, and we're going to go ahead and pay them. So it really is dependent on the actual credit union and what your policies are set at. So sorry for the vague answer.
Right, and now
it's about.
Sorry, and now for everyone who also has been asking, will the slide deck be shared? Yes, we can share that at the end of this as well. We have quite a few questions that came in about that, Tim. I guess people really like your slide. So, and then we had another question come in of how do you handle employees coming off sick leave but still obviously sick? For example, lots of coughing and sneezing.
Well, you could have in your policy, as far as contagious diseases or whatever policy you're going to take a look at as far as sick leave, you could require that they come back with a doctor's note. And if they are sneezing and coughing and it's just kind of a layover or lag from the flu or whatever it may be, you definitely want to make sure that we're cleaning and wiping down their areas a little bit more, but you don't want to segregate them, quarantine them into a conference room somewhere, but be aware that other people around the area may be working in that same department. They may have a concern and come to HR. So the HR needs to be prepared to just kind of let them know that they came back, they're cleared from the doctor, everything is okay.
All right, Tim, we have a couple more here. We have one of when would we know when the virus is retreating?
As we start taking a look, once again, taking a look at the World Health Organization or the CDC, they actually have a lot of good information out there and graphs, and you'll actually start seeing from there as far as the uptick or their graphs that they have. But when we start taking a look at it, just listening to the news, you'll start seeing a lessening of the outbreaks in cases and people being quarantined. So, but do be prepared. There could be an actual second wave that could be coming.
Terrific. Thanks, Tim. We've got another one here of does OGO have a sample communication that we could use to alert our staff and our membership about the scams associated with the pandemic scenario that you touched on earlier, Tim? Or is there something we could recommend to include when sending some sort of an alert out to the staff about that?
Yeah, for our partners, our BCP partners that we have, we can definitely help you craft that. Should you need it, definitely we can do that. Yeah.
Awesome. Yeah. So for anyone who is an OGO client, our BCP along with our cybersecurity team are happy to create a template for you if you're interested in sending that out. Great question. So we've got one more here from a current OGO client that was saying, I have a tabletop exercise that's scheduled for next week, and we were planning to focus on an evacuation. If we or other credit unions have these tabletops scheduled, should we change gears and focus on the coronavirus instead?
I would definitely recommend that you do change that. unless you have a recommendation from one of your exams or audits that you do an evacuation scenario. But as you know, during the current time and the way things are with the coronavirus, I would definitely take a look at doing your tabletop as a pandemic or outbreak.
Terrific. Do we have any other questions from the group that people want to pop into the questions chat? I know we went a little bit over. Thank you guys for sticking with us. Please feel free if you have any extra questions to put those in the chat. We'll stay on a few more minutes to answer those. And I will say, of course, if anything comes up afterwards, please feel free to reach out to us at info@ongoingoperations.com. Or if you have any specific questions and you're, say, a client of ours on the BCP side, of course, feel free to reach out to Tim and Mark on our BCP team directly. Now, as we're kind of waiting again, we'll go ahead and send over to attendees this the slide deck if you would like that. And there will be a recording available of this presentation, which will also come out when we send an automated email after this with a link to our masterminds page on GoToStage. So if you want to share this with anyone at your credit union or review anything Tim talked about, that'll be available as well. So as we're not seeing any more questions coming in right now, again, feel free to reach out if any strike you afterwards. And thank you guys for attending. And thank you to Tim for the wonderful presentation and all the information.
Yes, you're welcome. Thank you, everybody, for attending.
Yes, so have a great day, everybody. And hopefully we'll see you at our next Lattes and Learnings.